Health Task Force to address the country's lack of such resources. The initiative is being led by Vice President Mohamed Juldeh Jalloh. So what is this task force going to do? Africa Daily's Alan Kasuja has been speaking to Vice President Jalloh about the government's plans.
Today in Sierra Leone, only 1.2% of people with mental health disorders have access to treatment. This is just in the western region. It is picking up a momentum, and you can imagine across the country where facilities for treating mental health is not that adequate. And it is as a result of that prevalence that His Excellency decided to establish a presidential task force on mental health so that we can address it with the urgency it requires and the kind of support and commitment it requires.
And I just wonder, when you look around amongst your friends, amongst your contemporaries, people who endured civil war, who went through hell, do you see that a lot of them are not well, a lot of them could do with help?
When we wanted to launch the mental health task force, somebody said that maybe most of us here are suffering from mental illness, but because we don't have the specialists, we don't have the kind of doctors, we don't have the kind of clinical experts to determine that one. People don't know. Lately, increasing alcohol and substance abuse have no doubt become one of the most important triggers for mental health disorders.
Tell me a bit more about the work you expect the task force to do and what services will be available.
The Presidential Mental Health Task Force, which I chair, consists of several ministries. Ministers of Youth, Health, Education, several ministries, including Internal Affairs. That is the strategic level. That is where we drive the policy, we drive the action. First, we said we are going to review the 1902 Lunacy Act. So we are going to have a modern mental health legislation.
It was actually called the Lunacy Act.
Yes, the Lunacy Act of 1902. And then also devise ways to address mental health that has contextual and cultural appropriateness. So we are not only going to focus on the treatment gaps, the lack of doctors, the lack of nurses, but we have decided that we are going to look at it from the multi-sectoral approach, which means we want to look at mental health within an ecosystem, that it is not only about clinical issues, it's also how various sectors like health, like social welfare, like internal affairs, like youth, like employment opportunities, like laws that can guarantee access of women in workplaces. So all of these is what we put together, what we call the multi-sectoral approach. Secondly, we said we are going to engage on a nationwide awareness campaign. We want to increase awareness. We want to increase access. Now we are going to train additional nurses. Today we have 20 psychiatric nurses, 2 consulting psychiatric physicians, and 1 psychiatric doctor. We have invested money with development partners to renovate the new psychiatric hospital at the Kisi, and we are expanding those kind of facilities beyond the western area to include other parts of the country, the 4 regions.
That was the Sierra Leonean Vice President Mohamed Juldeh Jalloh. They're having a chat with Alan Kasuja. And if you want to listen to a longer version of that interview, just search for BBC Africa Daily wherever you get your podcasts.